focusing on men's health for a second, I developed a big men's health practice in Michigan. And we focused on really four things. We focused on benign prostate disease, meaning urinary problems, frequent urination, getting up at night, urinary infections, that type of thing because of prostate enlargement. And the second thing was prostate cancer. The third thing was testosterone replacement, which has become really important, and rightly so. And the fourth is erectile dysfunction, and which is also that is not a lifestyle issue, that's an important medical problem. And erectile dysfunction could be the sign of other significant medical issues. We know that men who have erectile dysfunction have a higher risk of heart attack and stroke because they're both vascular diseases, and the vascular disease part of it occurs first as far as erections go. So, I think in the past, men were always reluctant to come in and see a physician. Women were much more proactive about their health. What I'm seeing now is that I'm not seeing people that have seen their pediatrician at 14 and the next doctor they see is at 55 or 65 even. I'm seeing men be more proactive in their health. They're interested in issues surrounding their testosterone and regarding their urinary issues and looking at screening for prostate cancer, which is relatively easy to do. And we can provide all that relatively easily here. And I would encourage men who have, erectile dysfunction can be a tough thing to talk about. That can be an important thing to talk about. So I've always encouraged men to come in and talk about that and let me know if you're in your 30s or 40s or starting to recognize things. That can be the sign of some other long-term medical issues. Looking at prostate problems, again, one of those things that's easily assessed. There's not a lot of invasiveness in the assessment, and we can talk about relatively simple and straightforward treatment options that can improve your quality of life. Prostate cancer, 280,000 men are going to get diagnosed with prostate cancer this year. 35,000 are going to die from the disease. And prostate cancer is a fickle disease because there's a lot of prostate cancer that doesn't need to be treated, but there's a lot of prostate cancer that isn't assessed early enough and successfully treated. And talking about that and seeing me and getting a PSA and having a rectal exam is incredibly important.